Hi guys, today is Pharm Friday, where I get to talk about what I love most, and that is pharmacology. So I'm not going to do this every Friday, just like every other Friday, once a month, I don't know, whatever I feel like. I have whiteboards behind me in case I need them, but I don't anticipate needing them. Because today we're talking about aspirin. Aspirin's pretty plain and simple. Let me write up the abbreviation for aspirin if you're in the medical community. The abbreviation is ASA. So, I don't know if you can read that, but basically a lot of people are allergic to aspirin, but if you see like an order or on the little allergy tab on a file and it says ASA, that stands for aspirin. Now a lot of people think aspirin is a blood thinner. Blood thinners do not exist. I will be breaking that, so stay tuned. There is no such thing as a blood thinner. Blood thinners do not exist. Nothing thins the blood except for water. Water is the only thing that thins the blood. Aspirin is a platelet aggregate inhibitor. I will write that up there. Okay, so I wrote up two different things up here. The first one is platelet aggregate inhibitor, which basically means the aspirin helps to not get the platelets to stick to one part of the vein or artery. That's why a lot of people take aspirin to prevent a stroke. So that's one thing. The classification that aspirin sits in is not an NSAID, which we will be talking about NSAIDs in another video. It is in the salicylate class. So kids that take aspirin are at risk for Reye's syndrome. So that is why kids cannot take aspirin. Also, Pepto-Bismol contains aspirin, so do not give Pepto-Bismol to your children. Aspirin serves more than preventing platelets from collecting. It also can help with pain. Some things that you need to watch out for with aspirin is bleeding. That's like the big one. Is bleeding. Making sure that you don't have any kind of reaction, so looking for a rash. Or checking your temperature, making sure that you don't have a fever, anything like that. The other thing is that you need to take aspirin with a full glass of water. And another thing is there are different dosages of aspirin. So typically 81 milligrams of aspirin is the lowest dose, and that is considered a baby aspirin. So if people say, oh, I take a baby aspirin, it's that. There's also 325, which is kind of like the full dose, the, regular dose. So there's that. Now, getting into more sciencey stuff, there is something called enteric-coated aspirin. It can be seen as EC, or they may actually spell out enteric coated. So enteric coated aspirin, and they do this for a lot of other drugs, is basically where they put a protective film over the aspirin so that it can go through the stomach acid a little bit better, and then it kind of does a delayed release. So it doesn't, not the full dose of the medication does not go into your system immediately. It has a delayed release. So with enteric-coated or delayed release aspirin, you cannot crush it. Let me say that again. You cannot crush enteric-coated or delayed release aspirin, or any drug for that matter. Don't do it. Don't get tempted. If you need to crush it, don't get the enteric-coated. So just don't do it. So another big thing is if you are taking aspirin and your gums are bleeding, or you have ringing in the ears, also known as tinnitus. You probably can't read that. You don't need to, because it's not important. If you have a lot of bruises, if you have black tarry stools, which we'll talk about, like peptic ulcers and upper GI and lower GI bleeding later, but if you have black tarry stools, you have a fever that's lasting at least more than 3 days, you need to call your doctor immediately, because that's not good. And you probably have a toxic level of aspirin in your body, which is great. That is pretty much it. Oh, do not drink alcohol. Don't do it. Not good. Not good. Not good. Not good. So, if you have any other questions, let me know. And I will do another medicine. Why don't you guys let me know what medicine you want to see? Because I'll pretty much do anything.